What is the role of mentor or a senior doctor or head of the department in the emergency department during this COVID-19 outbreak? It is very important. We all know that the departments are run by junior most doctors 24 bar 7 and senior being available during the morning shifts. We have to do a lot of trainings, simulations, hands-on trainings for the doctors, nursing staff and paramedical staff. I have two to three concepts which will definitely improve your work in the ED 24 bar 7. The first and most important thing is do simulations. Whatever protocol you are following in your ED, do lot of simulation. What I follow is MTER concept. Whenever there is no patient, that is the best place to learn. You simulate that a patient coming to the ED with history of fever, cough, cold. Let them do the screening, how they will do. Let them triage the patient. Let them do the resuscitation and discuss about that. MTR is the best place to learn a lot of things. Let them know the environment. Let them know the division of your ED. Let them know how to use the PPE. Let them know the drugs, the equipment, instruments, how you need to handle them during the resuscitation during this pandemic. One more thing is you can use a whiteboard for your education purpose. You put two whiteboards in your department, one for your clinical guidelines, one for your admin updates. Clinical guidelines, make sure that you write something on the board like how you will triage. What are the clinical management basics in dealing a COVID-19 patients? How you need to oxygenate a patient? How much fluid we can give to the patient? What are the recent updates on prophylaxis regarding HCQs? You can write something about that. You can write about AHA updates also. During the resuscitation, what the precautions, what are the recent guidelines about resuscitation according to AHA. If something you write about clinical updates on one whiteboard. And the other admin whiteboard, you can write the updates about your local DMHO and your state and national central government Ministry of Health and Family Welfare, and from the ICMR, from AHA, from WHO, from CDC, whatever the latest updates, guidance or directions towards the hospitals, towards the EDs, you can write that. So make sure and do a lot of simulation. I'm telling you, simulation will help a lot because this pandemic is very new to us. We don't know what is happening. The type of PPE we are changing every day. We started with simple mask and now we are wearing N95 mask. Upon that we are wearing another mask and we are using a acrylic box for intubations. Lot of innovations are happening. Lot of updates are coming. Lot of guidelines are changing. You do everyday simulation, every day simulations will definitely help the resident doctors to understand very well. And one most important thing is let them practice very well and don't don't demotivate them if they do some mistakes also, because it's need for them also. If they do some mistakes, please don't demotivate them, encourage them because they're very young. You need to encourage them a lot. Tell them it's not fault finding, it is learning, because we are telling them the mistakes. Because if you do mistakes, that is not affecting the patient, that is affecting everyone in the hospital, affecting him also, his family, ours, everyone, because it's one simple mistake in doffing a PPE that makes a disaster. If you see a patient with a strong suspect and you wear don the PPE very well, and if you don't do doffing properly, that's a disaster.